Hi, good morning, ladies and gentlemen. Thank you for giving me the opportunity to share my experience in using hemoblock in my liver surgery. My name is Dr. Hairol Othman. I am one of the consultant HPB surgeon at Sunway Medical Center in Kuala Lumpur. My area of interest or expertise is in liver resection and Whipple's operation. Today I'm going to share with you two cases of non-anatomical liver resection, which I used the hemoblock with. And at the end of the presentation, I'm going to give my conclusion and summary. As you are all aware, liver surgery is a major surgery which involves either resection of a segment or segments of liver, or the whole liver, such as in liver transplantation. And the liver is a very vascular organ. It receives two blood supplies from the portal vein and the hepatic arteries. Hence, surgery on the liver requires meticulous dissection to avoid bleeding. Nonetheless, bleeding do occur, and a good hemostatic agent is very important. There are so many hemostatic agents available in the market. I was first introduced to hemoblock solution by Mr. Dimitri Mengelet in 2019. Hemoblock is an aqueous solution containing silver nanoparticles. It was said to have local hemostatic effect. I have doubt with its capability initially until I gave it a try in my surgery. Now that I'm a believer, I'm very impressed, and I call it the magic water. Let's start with case number 1. Madam ST is a 49-year-old lady diagnosed with cholangiocarcinoma involving the segment 8 of the liver. She had undergone segmental resection of the liver on the 24th December 2024. This is the MRI images taken before the surgery. She has a single lesion at segment 8 measuring 6 by 5 centimeter. This video demonstrates the application of hemoblock on the raw surface of the liver after the tumor has been resected. The hemoblock solution comes in a 30 ml vial. It is enough to cover the cut surface of the liver and also on the bare area posteriorly. It can be applied directly onto the liver surface, like shown on the video, or sometimes you can soak it onto a gauze or gumji and apply it to the surface. This is the end result of the hemostasis achieved after applying the hemoblock solution. This is the chronology of the patient during her recovery phase. We were able to remove the abdominal drainage on post-operative day 2. She was transferred out from the HDU on post-operative day 3 and was discharged home on post-operative day 6. Case number 2 is a 76-year-old gentleman, Mr. CCS. He was diagnosed with hepatocellular carcinoma in September 2024. The CT scan showed a single lesion measuring 3.5 centimeter at segment 6. He was stage A according to the Barcelona Clinic liver cancer. His alpha fetoprotein was 2.39 nanogram per liter. He has good performance status. He has an underlying hepatitis B, but has been on treatment with entecavir since 2022. He has a good liver function, Charles Pugh A5. He underwent segment 6 liver resection on the 3rd October 2024, and he was discharged on the 9th October 2024. The histopathology report confirmed the diagnosis of PT2-HCC Edmondson grade 2. Intraoperatively, we have used hemoblock on the resected liver surface too. I was very impressed with the performance of the hemoblock on the bleeding parenchyma. The hemoblock helps to dry up the oozing from the capillary bleeding. I do need to apply some pressure, and it takes about 2 minutes before the hemoblock can achieve hemostasis.
Okay. Running.
The hemoblock form a resorbable clot through interaction with albumin in the blood plasma. As you can see, the resected liver surface looks dry. Post-operatively, there was very minimal fluid collection. I was able to remove the surgical drainage earlier than expected on post-operative day 2. I was told that the silver ions and the nanoparticles which become incorporated in the clot have a bactericidal effect too. Hence, it can also reduce the risk of intra-abdominal abscesses formation. These are some of the indirect advantages I have discovered. The hemoblock has a potential to reduce the need to use surgical drainage. In the future, maybe I don't have to leave a surgical drainage, hence allowing faster ambulation and discharge from the hospital. And the patient may not need a long course of prophylactic antibiotics use to prevent intra-abdominal infections. This will further reduce the cost incurred to the patient. In summary, liver surgery can get very bloody at times, especially in the non-anatomical resection. Good hemostatic agent is very important. Hemoblock has proven effective in achieving hemostasis in liver surgery. Thank you very much for your attention. This is the picture of my hospital. It has 6 towers and has around 1,000 beds.